afternoon, everybody. Welcome to the Tuesday, April 18th, 2023 Macon County Health Department Board. The time is 5:33. Can we have a roll call, please?
Mark Schmidt. Jeff Hitler.
Here.
Candy Clevenger. Here. Carolyn Wagner.
Here.
Jen Hack. Here. Debbie Hill. Here. Dr. Jerger. Dr. Meningati. Cody Parks. Dr. Smith.
Yes.
Marcia Webb.
Yes.
Dr. Jerger did tell me he would be here at 6:45.
And I know Cody was planning on telling you that things may change in the situation. Please join me in the pledge allegiance.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, do we have any public comment at this time? Yes, ma'am.
I'm Linda Keyhart. I was on the cemetery board when you did the gates.
Yes, ma'am. If you don't mind standing up and speak to us.
Sure. I am the mother of, this being Mr. Keyhart, mother of a daughter with Lyme disease. May is Lyme disease month, and I came to you because of guilt this week. Not much is being done in Macon County in terms of educating physicians and others about Lyme disease. I have a whole list, which I won't read, of things that's happened. We're in our 12th year of dealing with our daughter who's now on oxygen and unable to work with a livelihood, but gets about $1,200 a month in disability and has about $1,300 minimum a month in medical bills. What happens to people with Lyme disease is a little overwhelming. A tick carries about 40 bacteria, and our daughter happens to have 6 of those, and the last one most recently, as well as she picked up Omicron. In that process of all that happening, she gets less blood to the brain. So our Melissa is no longer our Melissa. I'm her caregiver. I've been on the Illinois Lyme Task Force. Mike has been president of the Illinois Lyme Association, which is newly formed. And we've done a lot of work, but not much has happened here. And in the mapping of Illinois, Macon County is listed as having 0 Lyme patients. So nothing happens here because we aren't anything. And I worked here, this was a senior meeting place when I worked here with Dan, worked with Jerry for a long time with the foundation. I come to you to say that there are ways for us to help anyone who might be bitten by a tick. We have a couple of small farms, I mean real small, bigger than a tomato patch, but not much. And I have learned a lot, worked with Johns Hopkins, who's done the most research, worked with a few doctors in town. DMH has sponsored a doctor from the East Coast, did a tick presentation for the SIU family practice residents. But I haven't touched what was near to my heart, and that was public health. And I would like to offer to you the tuition for a physician in Macon County to become a Lyme literate doctor. It's a 3-day thing in Philadelphia. We will pay for the training if you guys will come up to get them to Philadelphia, I guess, and if it's necessary, I could do that too. I never want another family in Macon County to endure what we are. Mike works hard. I take care of her. I'm just tired. We're both 80. And, well, I'm not quite, he's older. I come to you knowing that early diagnosis is the only key to not being in the position we're in. It does. Dr. Smith may have worked with this, I don't know, sir. Diagnosis and treatment. Diagnosis early, There's a test, IGenics is a company, and that's the big whammo test, it's expensive. We have a bill passed where those things are paid for now. I've never done that, wore out 2 pairs of shoes over there in the halls of justice, or whatever that's called. But I do believe that all of you, and I looked at the list of people, I know, Mark, you've been active, and I only knew you through the cemetery, that's probably not the best way, but, and ladies along here, I've met over the years, and I want you to know that we can become a community that treats Lyme tick-bitten people quickly, doxycycline 6 weeks, that's it. But they have to be tested, and they have, well, in Wisconsin, they don't test. If you come in and you say, I've been bitten by a tick, by gosh, you get that doxycycline and you're on your way. That's a whole lot cheaper than $1,300 a month. And Melissa's doctor, by the way, is in Orlando. Isn't that sad?
Wow.
That we have to do that. Illinois is not flush with people knowing this. Jennifer Russell runs the Illinois Lyme Association. She will welcome getting someone signed up to go to Philadelphia, and the Keyhearts will pay for it. And I know we can make a difference here. I know 100 people with Lyme disease in Macon County. There's no reason you have a 0 recording. So I'll do whatever it takes to, been an old woman too. I'll do whatever it takes to get you moving forward in doing that. If there's someone who will take on the challenge of going to Philadelphia and learning to be a Lyme literate doctor.
I think that's really awesome of you to make that offer, and we
I
will
am
definitely,
awesome.
we will definitely,
Yeah.
well, we will definitely, Lindsay will work on pursuing that, and we'll talk to the,
I will do it.
Medical
I probably
doctors you
know more
have.
about ticks than any human being on earth. And by the way, they're out right now. They're
Yeah.
everywhere.
well, is Marissa here? She's back there in the corner somewhere? Okay. So Lindsay, make sure that we provide this information about this to Marissa. And I know in the past, I think there's been like some PR stuff, timing wise with talking about ticks and Lyme disease that the health department's put out. So let's put down a reinforced effort to do that here very soon.
Okay.
And then get her contact information, and then let's discuss, what might be a good fit as far as positions, whether somebody in the health department or outside the health department.
Mike and I don't.
To facilitate getting it done. That's a really generous offer.
By the way, U of I's natural history, they did an allergen study, at least 40% of all ticks carry something. I even donated to them to test for Bartonella, because our daughter had done the research on that. She called me 2 weeks later, she said, Linda, you won't believe it, somebody just brought a raccoon and it has Bartonella from a tick bite.
Well, we have a lot of people get exposed to ticks here. We have a lot of
Right
wooded
now?
areas and things like that.
Mushroom honey.
Mushroom honey is a big, mow your yard. I mean, we don't know why it's gathered, but the Midwest has been left out of the moving forward, so.
Why is Illinois not eager to give that drug out that you mentioned?
Your doctors? Well,
And why is Wisconsin so eager?
Because
anything I say would be not nice.
Well, I would say because they have higher rates of deer tick up
They do.
there and higher rates. So in Wisconsin and those states, they see more of it than we do.
No,
But-
that is actually accurate.
But
The northern part of Illinois, next to Wisconsin, you can go to Findlay, Illinois, where we were today, and there are ticks crawling around all over.
sure.
And it's not that, somebody told me yesterday, it's like, they thought women were mentally ill because women tend to report it more often. It really isn't. Illinois reports 300 cases of Lyme a year. CDC doesn't help. It's really a stigma attached to Lyme disease.
But I think that's because they're not testing.
Oh,
So
absolutely.
the only way they get a report is if they actually do the testing.
The IGenics test is about $2,000. I'll tell you how much it is. We just had her repeat that, and it was largely paid for by for awful health insurance. And Demi, I called around to see who could administer it, because it has to be shipped out immediately. You can't, it has to be overnighted. We were there 5 hours while they tried to figure out how to do the testing. And Crossing was helped, they had a support group, that doesn't work because there's a lot of mental illness in the whole situation, and they all get different treatments. I was telling them, there's one young man who does 5 coffee enema treatments a day, which I would think would be a little bad on your butt, but they're just, people are on gluten-free diets. Our daughter is on antibiotics and shouldn't be, but if she doesn't, she dies. So, it's education.
Yeah.
And, that was my background. I know we can do this. I don't even want to care about the rest of Illinois. I've been working on that with Jennifer Russell for a long time. I want us, right here in this room, to move forward. And you can't be around Melissa Keyhart more than 5 minutes and know she's in big trouble. And I want you, I was in community health because I believed in it, and I want you to help us. So thank you.
Absolutely, appreciate you coming in and letting us know what that.
Presentation.
Now,
Also,
he
if
might
you-
want to say something, but I don't let him talk.
Ms. Keyhart, also, we have a representative from the media here. If she had any follow-up questions that she wanted to go out and talk with you about, that maybe
Okay,
she could
thank you.
do a little bit more to promote the school.
Well, I'm very shy, so it's like,
Hey, Mark,
Yeah.
I just want to say, I contacted Linda. I have a friend of mine who was diagnosed with Lyme disease. I don't remember now, 6-8 months ago. And there was nowhere in Decatur that could help her. And at that time, they didn't have, her health insurance wouldn't cover the big expensive thing. And when you're talking, families who are barely making minimum wage and trying to do everything that they can for their families, Linda was a wonderful resource and a great resource to really help me with my friend moving her forward.
I gotta add one more thing to that. I'm glad she said that, because we take Melissa out of Illinois because the pain is so bad, because it's an arteritic type response. And our vet in town is terrific, and he told this lady whose husband had Lyme disease to contact me. I answered the phone. I'm in Fort Morgan, Alabama, which is the end of the world, and this woman just starts swearing at me, just straight. And it was going to be about $9,000 for him to start treatment, and they didn't have the money.
Wow.
Now, why was that not covered? Because it wasn't part of a protocol that we could have gotten the legislature to pass. So it's not perfect yet, but it's sure a lot better than it was before.
Well, thanks for coming in and sharing
Thank you.
information with us. I appreciate it.
Can we get your information?
Sure. I'm always.
I would just add to that, recent studies have shown that the diagnosis from tick bite to diagnosis of Lyme's disease is about 3.5 years.
Nobody can diagnose
It's-
in
it's
the beginning.
huge.
Well, they can, they just don't pay attention.
Well, people don't know they've been bitten.
Right.
And people
And they don't remember
know.
where.
Yeah, and I've had a very close friend that had it, and I remember watching her think she thought she was gonna die.
Yeah.
And I knew she wasn't crazy, but I didn't know what was going on.
Every presentation of Bell's palsy should be screened for Lyme.
Yeah,
Every presentation.
yeah.
It doesn't always have to.
Definitely something.
Okay, anybody else for public comment? Thank you.
Thank you.
Thank you.
Linda, oh, did I read my first? Yes, ma'am. Help me. Thank you.
Okay, motion to approve previous board meeting minutes, Board of Health meeting minutes from March 21st, 2023, Board of Health special meeting personnel committee, open meeting April 5th, 2023, Board of Health special meeting personnel committee closed April 5th, 2023.
I don't think they've seen the ones, have they?
They got close earlier, I don't know if they read it.
Oh, okay. Am I also approving everything that's in here if I,
We're just approving the minutes for the meeting,
oh, okay, gotcha.
meeting minutes. Motion to approve.
Second.
All those in favor?
Aye.
Any opposed? Okay, Board of Education, nothing on that. Presentation acceptance of the financial report.
All right.
Ms. Lakia.
All right, this report is for March of 2023, ending 3/1/23. We are 33% into the year. Our fund balance currently sits at 7.69 million. Total revenue to date has been 2.15 million, which is 30.3% of budgeted revenue. Expenditures are coming in at 1.8, which is 20.6. The money market is currently sitting at 4,014,000. Since last month, the increase has been about $10,200 or so. The interest on the checking account is currently at 3,104.27. And our, like I said, the ending fund balance is 7.69 million. Questions?
Just a comment, and I think you're aware of this because you were there last week. So Mr. Jackson told me at the county board meeting last week that the money that we had decided to set aside for drawing some interest on it has been moved to get us 5.06% now. So that's a big jump from what we had. So that was some really good news to hear that we're making that money work for us. And appreciate him staying on top of that. Okay, motion to approve the financial report.
I'll make a motion.
Is that you, Carolyn?
Yes.
All those in favor?
Aye.
Any opposed? Motion carried. Okay, review and approval of department expenditures. Anybody have any questions for Lakia on that? Okay, motion to approve expenditures as presented.
I'll make that motion.
Second by Candy. All those in favor?
Aye.
Any opposed? Review CFO Board of Health Flex Time report.
I have a question. I think I probably know the answer to it, but in looking over the flex time, I noticed that our RIC department has an individual with a lot of hours, like 60.50. And I assume that's because we have so many vacancies. And we were wondering, what can we as a board do to help you to save this person from burning out?
I just want to make a note. I know it says 60, but it's
Okay, yeah.
significantly lower than that. However, if the time hasn't been used yet, so she has a lot of requests. I would say it's probably like 39 hours that are not to be used
Oh,
in
that
the
are
coming
pending.
week.
Oh,
But since they haven't been used yet,
Sure.
the system won't take it away. So it's about half of that right now.
Okay, but
But then,
she's
yeah.
still
But yeah,
accruing.
she is still accruing
She's
a lot.
still accruing.
She serves in a capacity of a breastfeeding coordinator. She's also a CPA in the program. We don't have any breastfeeding peers, so she's working in some of that as well. She literally is excellent at letting me know when she is at the point that she feels she's over the limit. So I am adhering to the 35 and under policy, even though it doesn't look that way because they're planned days off.
Right.
And she is constantly in touch with me, and I let her know I don't want the burnout. I assess how she's feeling, how she's doing. In terms of what you can do, I don't know the answer. I have to have qualified applicants to hire for the position.
I'm looking at
Yeah.
this. I discussed with Lindsay what the qualifications were for the CPA, and hoping, I was asking, was there any movement within the state
to maybe relax some of those regulations if you found the right person that had like a teaching background?
It's not about that, it's about those credentials that are related to either registered nursing or nutrition. I just learned from a dietitian yesterday that they're planning to now move dietetic programs to require a master's to become an RD or to graduate from a nutrition program. They won't even have a bachelor's level anymore. It's just getting harder and harder. There is a plan that they have in place where if you have an RD on staff, they're allowed to train paraprofessionals to do work in the program. I have an RD on staff, but she's obviously functioning to secure the caseload. I can't give her another assigned duty.
Gotcha. Could you use ancillary staff who could do biometrics for you?
Oh, sure, we can always have them doing the weights and measures and the anthro, but it doesn't change the requirement for Amy to still complete her duties.
But would it cut down on their roles, their
In
responsibilities?
an in-person service, yes,
But
we've been remote for 3 years and she's still, you can see, when you're this low on staff. I am in the middle of my WIC review as we speak, and I've let the regional nutritionist know from the state how difficult this is, and I'm getting a corrective action because of not having enough staff to serve the assigned caseload. We should have 4 CPAs and we only have 2.
Does the state higher up have any answers for you?
No, they say this is happening everywhere, and especially in local health department settings for WIC programs. There's just so much turnover and the requirements are so specific for the credentials. And I am not, even as a registered nurse who supervised this program for 18 years, I'm not allowed to supervise and train the paraprofessionals. It would have had to have been Lindsay with a master's in nutrition or an RD. That's the only one that we're allowed to do the work of training these paraprofessionals. But they will allow me to take my clerks and teach them how to do the weights and measures. And I'm gonna find out if they're allowed to do the hemoglobins and the leads too.
Well, if there's anything, do you think it would help to get our local legislators? Is there any roadblock?
I think that the RD and I were talking, Amy and I were talking, the person you're referencing, and she just feels like there should be a dedicated type of recruitment taking place for qualified candidates. Some kind of outreach, HR level recruitment process that works to try to engage people to apply.
For the state, you're talking for the.
No, she's saying locally, whatever this agency could do. Because we can't, the state has stolen my people, and I mean no offense, I say that with a light heart.
I understand.
They've literally said, oh, I like this client or this RD, I'm gonna offer her a job, and literally I've lost 2 I know to the state.
All right, well, we're trying. I know later on we have something to look at with regards to looking at our salaries and that, but recruitment, if there's something we can do, I don't know, please.
If there's a recruiter that you know of that could help with that, I'm sure we can figure out how to fund.
I'll definitely
Something like
let
that.
Lindsay know. Amy just talked with me a little bit, but I don't think it wasn't a named individual, and it was something from Missouri maybe. Missouri has even more stringent guidelines for what WIC staff are allowed to do and not do, and who can do it. It's very discriminatory in a way, I think, and they think it's for the best for the program, but it's certainly hurting us in terms of trying to meet our need.
If you can't serve the public because your
Yes.
hands are so tight, then that defeats.
The salary is a huge chunk of it, and the regional nutritionist said that to me yesterday.
She did confirm to
She
you.
said, why would someone go through 6 years of training, become a master's or a registered dietitian, and then come to work for $40,000 a year? They're not gonna do it. And so she just thinks they're struggling everywhere with local health departments for WIC programs.
And who is this lady?
She is my regional nutritionist, but she's from Granite City, actually, she's southern.
Okay. through the state.
Yeah, she's a
Okay.
registered dietitian that
Gotcha.
works for the WIC state program.
Thank you.
Thank you.
Okay, I have a question on, the reports for environmental health. Kathy, have you secured any additional staff as of yet?
For environmental,
Yeah,
we do have a new environmental health specialist. I don't, was she with Jerry? Were you? No, okay. Emily Swineford has started with us. She was a microbiologist that unfortunately lost her job with Acorn. So she does meet all of the qualifications with the bachelor's, the hours in science and everything. So she did start I think last week possibly. So yeah, we have that one filled now.
okay.
Good job.
Anything else on division reports for anybody?
Oh, division reports. Kathy,
Wait, we're scooching down. Okay, yes.
Sorry, we got sidetracked in that
Kathy,
quick conversation.
on your
Yes.
division report, the only thing I saw was that I think your percentage of closed facilities is wrong. I think it's way lower.
Oh, it probably is. It's
Yeah.
probably 0.02
It's
or
like
0.02.
0.0021.
Sorry.
That's okay.
That's multitasking at its
Well,
finest right there.
Yeah, I didn't want you to look like you were closing everybody down.
Thank you, I appreciate that.
Yes.
Anybody else have any questions on the flex time? I'll back up. Sorry, because I knew there wasn't any grant, so I moved on to the next item on the list. So that answered your question about the flex time
It did,
accumulation, okay?
it did.
All right, so moving on from that, we have division reports. Does anybody have any questions on the division reports? Okay, hearing none. Employee recognition. The only one we have for April is Sally Williams, 26 years.
Yeah.
That's big. Okay, old business. Discussion regarding status employee retention bonus program proposal. And I will say that myself and Lindsay and Lakia and Marcia and Carolyn all went to support the health department staff by attending the county board meeting last week, and there was still a little bit of confusion, and I think it was an issue with the way the resolution was worded, but they discussed it. We kind of touched on a couple of points to clarify some things for them, and it was passed. So that's great news for everybody, and now it's just a matter of you ladies getting that going.
Carol, the auditor, she reached out to me the next morning, she was on it. And she wanted me to send her the recipients and amounts, and that's no problem. However, they were saying that they weren't gonna put this on a regular payroll check. So I wanted to gauge your thoughts on this. Sheriffs get paid out their holiday pay 3/1, 6/1, 9/1, 12/1. She wanted to know if it was okay with us if we can put this on the 6/1 payout for the sheriff, so that, we just wanna work with the auditor's office so we can get this figured out.
You mean like June, is that what you're
Yeah,
saying?
so they wanna know if it's okay if this, our first bonuses come out June 1.
Basically, they
Because I know
want to
the
simplify
policy
things
says-
for them for a check run then.
Yeah.
Right,
Oh, okay.
but the policy states after 2 pay periods, we have to pay it out.
Oh.
So I'm just asking for permission to pay it out 6/1.
So that's a really good question, number one. Number two, part of the money that was going to cover this
By 6:30.
initially,
By 6:30.
are we gonna be in
We're
a
fine.
predicament
Yeah.
with losing that grant money?
No, we just have to
Yes.
spend it all by June 30th.
Okay.
Okay. I don't have a problem with waiting, but I really hate to wait because we've been working on this since the beginning of the year.
Right.
And Ken's got kicked down the road twice now, not because of any of our doing necessarily, but I would like to see this get done in the next payroll cycle. If you have the time to integrate it and make sure that all the information is accurate before you fire that stuff off to Carol. I'd
But
like
it
to see it done.
should still be in a separate check, because if it's
Oh,
not,
no,
it
it should
gets
be.
into a new tax bracket, and there's gonna be more taxes taken out for them.
Well, you could end up in a new tax bracket by just gross income at the end of the year anyway. But no, it definitely needs to be a separate check.
So,
Yeah, we'll try to push it forward if we can.
Did
That
you-
was just, to kind of simplify, I think, what they were doing.
I get it. Well, we've got people that won't hit it until later on in the year, so they would probably fall into, so you said it's 3-1-6-1-9-1-12-1?
right,
Yeah. I mean, we might have to do something with the person that hits it after 12-1 if there
I
are.
think it was just for this time, but then after this, we would just go with what the policy says and that it has to be paid out within that 2 pay period after
Okay,
their milestone. She just wanted to simplify it by grouping it in with that extra payroll that she was already gonna
I
bill.
understand.
Well, if they're doing 3-1, if you walk it backwards, they're not doing calendar quarters, they're doing fiscal quarters.
Yeah,
So that's why the timing of that's that way, because it would start in November, go into December.
right.
So just December, January, February, so that's why they're doing it that way, I'm sure. Not to create extra havoc for them, but maybe they'll have to be understanding that we've been waiting a while for getting this done, and promising that we were gonna get this implemented as quickly as possible, so I really don't wanna put it off another month and a half.
Okay, well, I have to go down there every Thursday, so I'll talk with them tomorrow.
Okay,
Let us know if there's.
so glad that we got that finally taken care of. Discussion regarding dental update related to hospital sedation. Lindsay, you have anything on that, since Dr. Jerger's not here?
Yeah, so Kim, also feel free to chime in, but
Oh.
Yeah, Dr. Jurger and Dr. Kim, actually connected, and he is going to observe Dr. Jurger in the OR setting. And that's to go for there, at least he's gonna go in and observe and see how it's done, and they'll do that kind of discussion, and hopefully, he'll decide to do it. So that's all I know about that.
No other issues though, other than just going through that process then?
I don't know, kind of talking to Debbie on the way in, with St. Mary's taking away a lot of their programs, we're a Medicaid office, they lose money with us.
Right.
I'm kind of scared that they might not want us back, I'm not 100% sure, but we'll try.
Okay.
Is DMH an option?
We tried to credential through DMH when Dr. Higgins and I were gonna try to do both hospitals. I wanna say that might have been 6-7 years ago, they flat out said no to us at that time.
They what?
They said no, they didn't want us over there.
Really?
Yeah, I
Did
think,
they give a
again, because we're a Medicaid office.
Did they give a reason?
No, they declined us.
Did they?
Yeah.
Okay.
Are you mostly talking about kids?
Yes.
Yeah, St. Mary's won't do it.
I mean, we were there for years and years, but,
I know,
Once we
I
left.
remember, but yeah,
They
they
don't
they
have a
don't do
fee.
any kids, I can't do kids there.
oh, really? They've
Any,
changed?
any kid in Decatur that goes to St. Mary's ER and needs to be hospitalized, is sent to St. John's.
Well, I know they did, like if the child had special needs or like heart issues, they would deny us, but if they were healthy,
Healthy, doesn't matter, they come with
Really?
a broken wrist and I need to do a close reduction or surgery. It either has to go to DMH or out.
well, Dr. Jurger does kids up there.
At St. Mary's,
Uh-huh.
I don't know, I'm shocked.
That's another discussion then, yeah.
Yeah.
Huh. I'll have to, yeah, well, when it gets here.
Okay, discussion regarding salary assessment. We got a, I won't call it brochure, but you got a document in your packet on the salary assessor.
So I reached out to the Illinois Primary Healthcare Association, and I was unfortunately not able to get in contact with them. I called multiple times and left a voicemail, and then I thought, I probably shouldn't call too many times. So I did start looking into some different options, and I came across an interesting tool through the Economic Research Institute called a salary assessor, and like Mark mentioned, there's kind of an informational page in your packet. But I went through with a gentleman named Zach Heyer, who's just a representative of the company, and who kind of gave me a demo of how the tool works. But you can go in, and this is really small, I tried to blow it up, but I could not figure out how to get it larger. So I apologize that it's kind of hard to read. But essentially you go in and you're, looking for, okay, we're a government agency, this is the type of employee, this is how long they've been employed, this is what their educational background is, this is what their experience is, and then you kind of hit the button, and it gives you the, low, median, and high range for Macon County. And I did ask him, do you, because without being able to get into the system and truly click around myself, there's only so much I could see just from a simple demo. So I was, asking him, is this something other local health departments use? And he said that it is in the state of Illinois. And I also asked him if, we would be able to find every single position. And, obviously like a nurse or a dietitian, those are very well-known position titles. But he was able to kind of pull up different types of positions too that aren't quite as common and show me what the salary predictions would be for those. So I'm trying to think of an example, but or just a range of things. There's obviously a certified dental hygienist, and then there's a dental assistant that's trained on staff. So he was able to show me the difference on that. They have a very, very large range of, positions in their system. And it's just something we can look into. I did also bring, I don't believe that it's in the packet, but I brought a quote for what this service would cost us for a year. And it would cost $2,489 to have access to their database. And so really, honestly, I was expecting a higher price for 12 months, just given, sometimes what the monthly charges are for other services that we have. So, I'm sorry, 2,489, so about 2,500 for a year.
For 12 months. Access to it for a year.
Yes.
Is there any kind of a sign-on fee, like if we took it for a year and then didn't use it and we let it go and we picked it back up 3 years later to just double check how things are going?
I'm not sure on that, but I can definitely, so I'm actually meeting with him again tomorrow, because he
Okay.
wanted to follow up, after the board meeting.
Okay.
So I can ask him that question to make sure there is not an initiation fee
Right.
or a rejoining fee if we
Right,
did
right.
discontinue and then rejoin.
The other question I had was, did he give you the names of the health departments in Illinois that are currently using it?
So I asked him and he didn't really want to share. I don't know if it was just, I'm not exactly sure why, but I did ask him, do you mind sharing what other agencies in our, area use this service? And he just wasn't able to share that with me, so. Not
That seems
completely
odd.
sure. He's, also willing to provide a further presentation if there was any interest in you guys as members or board of health members, to actually have the opportunity to meet with him over Zoom or Teams. I know that you're all very busy, but he did want me to offer that to you if that's something that you're interested in, just a more hands-on ability to ask him questions. So, and of course, I can take any questions back as well.
Have you spoken to any other health department administrators specifically about salary evals?
Yes and no. I had it as a speaking point. I have there's a administrator meeting this coming Thursday in Springfield. And so I was planning to basically just openly ask them, is every health department in the state of Illinois? So I was just gonna ask them, do you guys
Yeah.
use this service?
Or if you don't, what do you use? Perfect, wonderful.
And also, most of them are very willing to share their
Right.
salary scales.
Yeah.
So I was gonna try to, have that conversation with some of them that I know a little better,
Good,
to maybe learn about what other agencies are offering as well.
wonderful.
So,
Sounds great.
Yeah, I'd say get more information as far as who's using it and more about the cost and.
Yep.
And, if they have the opportunity for a free demo, we can always do that.
Yeah.
Really wanted
Well,
And I
to see
think
it
they-
personally, though. Yeah,
I
it
mean, you
says
could
free demo.
certainly-
guide
Yeah, I
tour.
would like, I mean, I
You
think,
can certainly Google it and do a free demo to get in there and click around yourself. I thought it was very interesting with the amount of filters that you could put on the
so it
search.
felt very fine, you could get it
Yes.
really down.
Yes, it was very fine tuned.
That's good.
Can we make sure we put this on the agenda
Yep.
For next
each
month.
month until this gets resolved?
Well, I'd like to see us have information in order to actually
Make a
approve the
decision
money
next month. Yeah, I
for
just,
next
yeah,
month,
okay,
Yeah.
perfect.
Okay, sounds good.
so.
So I will get
Okay.
some more information on that and then I'll follow up with you guys next month about
Okay.
it.
Wonderful.
Okay, continuing on, new business interim public health administrator update.
So we are, actively working on filling our vacant positions the best that we can. As Kathy mentioned, we did just hire a new environmental health specialist. And we are in the process of hiring an emergency preparedness coordinator. And that individual has a bachelor's of science in Homeland Security with a minor in disaster management. So it's definitely a very promising candidate. Kathy has completed the interview and reference process, so it's just now a matter of offering the position. We also are working on hiring a new McBee family support specialist and are in the process as well with a nurse. So those last two I mentioned are not finalized yet, but we are moving forward on those and hope to have those finalized by next month. We are just continuing to try to be out in the community as much as we can. The Farm Progress Show will be coming up in August, and we always host a health and safety table. We're continuing to be involved with DPS and some of the events that they're hosting, as well as the Decatur Public Library. So just really trying to keep our name out in the community as much as we can and services that we offer. We're looking into some new trainings. We just completed a home visitor safety training that Kathy was able to organize. And that was really beneficial, I think, for our staff that do home visiting services and that have concerns about, home visiting and what could come with it. So we're also looking into a pepper spray training and a stop the bleeding training. So we're just, constantly looking at ways that we can keep our staff trained and, up to date on multiple different types of trainings.
Good.
We are in the process of implementing the HSI training platform, which I mentioned last month. We have our final call before we officially implement that for the entire agency on Friday. And so it's just kind of, a gentleman that's showing us how to use the system and how we make groups and how we assign trainings. And so we're looking forward to being done with the learning process and getting it going in our agency. But it just is a giant database that's gonna allow us to provide trainings to our staff on any and every single topic that you could possibly imagine. It's very short, 10 to 7 to 12 minute videos. They're not extensive. And so that's what we liked about this, is that it's not, when we're understaffed, it's not asking people to work through lunch to complete a training, but more so just short and quick to the point trainings. So we're looking forward to getting that up and going. And that is really all of the updates I have. And if anyone has any questions about any of that.
Status of your accountant position.
Yes, so we did, Lakia and I have hired an accountant who was previously a WIC clerk. Her name's Courtney Dick. So she started in that position on March 27th and is obviously in the, active training stages of learning the role right now. So getting her up and trained is gonna be a major help and relief for Lakia to be able to, share the duties of the role that she's currently in. So we're excited to have that going as well.
Great. Okay, discussion regarding update to bylaws relating to consent agenda.
So this is in your packet that Dr. Baggett typed up for us to review, and we can vote on it at the next Board of Health meeting in May. But I did email it to you guys as well. If you want to review it that way, you can. But I also included a hard copy. So once everyone has a chance to review this and agrees that, what we're going to include in our consent agenda, then we can vote on that in May.
do we have to make any changes on this, or pretty good with where we're at with this then?
That's the way, my notes indicated, the board wanted, the language to look, so unless you look through it and see something that you'd like to, make changes to. The reason you can't vote on it tonight is I didn't get this to Lindsay to send out to you, within, 2 weeks of tonight's meeting, so, we're just, per your bylaws, you haven't had this long enough to vote on it tonight. But if you ask me to make any changes to it, then I would say that even if I do it at the last minute, before May, you can vote on it then, because you'll have seen it at least.
Okay, any questions on that then? Okay, discussion and action regarding the Care Kiwanis Little Free Library at MCHD. I actually talked to the gentleman today because I spoke at the noon Kiwanis today about Lincoln Square Theater. He invited me to come be a speaker for their group. And so the gentleman that was here last month talked to us about the library program that they want to implement. It's various places around the county. So we had a brief discussion about that, so I just shared that today for everybody else's benefit then, since he wasn't planning on being here tonight. They got 3 locations they're looking at. They're looking at right now, I know there were some questions last month when he was here about when this might get implemented. They're tentatively looking at July 1st. They've got a few things that they want to get squared away, and they're getting some books. He had a really cool sticker. I didn't bring it with me, but they have stickers that they've made it with Kiwanis logo on there. It's library. It's a neat sticker that they've got that they're going to put on the books that they will provide on the hardback books, and then on soft books they have a rubber stamp that they're going to stamp the inside covers of the books. And the reason they want to do that is twofold. Number one, they want to promote the organization that's providing the books, but also as they screen the library on a regular basis to make sure that it's fully staffed with materials and stuff in it. They're also going to be taking on that responsibility to make sure that nothing should not be there that shouldn't be there, only material that they have distributed, to ensure that we maintain, the type of materials that are being put in there. He said they haven't had it, but in some other areas, there's been some places where people have gotten books and inserted envelopes or different things in them. So they're working on the logistics of ironing that out. They actually talked today about they're gonna have 3 people to a committee, and those 3 people will be responsible for a specific location. So they're gonna set up a schedule to come in, make sure that the little library is stocked up and things like that. So I mean, it's a good program, and I think what he said last month when he was here, I think it was pretty well received by everybody. But that's the update that he gave me today as far as the status of where they're at with it right now. And they'll be in touch, he said, as they get a little bit closer to time. They would like to come here because we have more room. So they're wanting to get a little press, publicity out of launching this thing. So he asked me if we would be open to the idea of them perhaps coming here to do like an official ribbon cutting, launching the program or whatever. And I told him that I would bring that to the board tonight, and I didn't see any reason why we would agree to that. But they want to promote what they're doing. I think timing wise, it'll be good because it's summertime, kids are out of school, and it's another thing to help when families are coming in here with their kids and stuff like that. They get a book and take it home with them, that type of thing. So I think it'd be nice.
Absolutely.
So.
Do we need to vote on that tonight as a official decision to have that here?
I mean, yeah, we probably can. I mean, I don't know if it's something that we actually need to vote on as an organization.
There's no harm in it.
Well, as the interim administrator, do you support the program?
Yes, absolutely.
Okay.
I think it's great. I obviously had a chance to talk with him last week too, and as a mom of 2 young kids, I am absolutely for, improving literacy in our county. And I think this is a, fun and innovative way to do that.
I don't think we need to take a vote on action wise. I mean, they brought it to us, and unless you guys want to vote on this action item,
I don't think it matters.
no, I don't think so. They were
Okay,
just
so I'll
asking,
just move
they were just
forward
asking us
then.
to extend the courtesy of doing it, so.
Yeah, I'll reach out to him
Yeah.
and figure out what we can do with that.
Okay. Discussion action regarding on-site deputies.
So we are currently scheduled through the end of May with our on-site deputies, and that is coming out of a COVID grant, how we pay them. And so those COVID grants are coming to an end here at the end of June. And so what we're wanting to ask you guys is that, to have your support to continue having deputies. They are paid $52.50 an hour, and they are here for 140 to 160 hours a month on average. So it is, would be coming from the health fund to be able to pay the deputies to be here, which is why I wanted to bring it forward to the board.
So did you have deputies prior to COVID?
No, we did not.
Only during certain times,
Okay,
during, when we knew we were gonna have a lot of heavy traffic, yes,
Gotcha.
definitely.
got it. So why did we get them full-time when COVID came then? What was the rationale for that?
The
It
vaccine,
wasn't safe, right? The vaccine and stuff, people were at the health department, it was getting rowdy out there.
Okay, okay.
Keep the peace.
And that has calmed down, obviously, to some extent, 3 years later. Rachel's out this evening, but, I'm not hearing a ton of situations that would, validate having them here. But I also know there are situations that certainly come up, and I know that their presence, obviously provides to our clients.
I understand.
Keeps safe.
I understand, I worked at CHIC.
Yeah, but from a financial standpoint, coming out, we had the grants to cover it for so long, and now those grants are coming to an end, and so the predicament of whether we keep those services.
Where
Do you
do we spend our
anticipate
money?
we might be able to have some grant funding for this in the future
I
at all
don't-
or not? Because we're talking almost $100,000 a year.
Yeah,
We currently don't. We, kind of as I explained, and you probably already know, we have allowable and unallowable expenses each time we do a grant. And so we go through the allowable expenses, and this is not something that's allowed in any of our grants that we currently have. So there's nowhere to pull that money from to pay these services, unfortunately, aside from the health fund.
What about a trial basis, after your contract runs out, what about a trial basis of doing without? Are you guys scared or?
I will say for staff, there is a lot of safety concerns. Not only, I'll say for my staff dealing with, let's just say restaurant owners, that if we've closed them, I will tell you that before they would come in, they would be very hot, they would be very threatening, up in your face. Now with the deputy there, they come in like they're your best friend and they want to talk to you about the weather and they're very calm. I know for Rachel and Amber that there's been some cases with STI clinic in the past, that they definitely needed one. I can tell you one situation at the time when I was over the lab that an individual brought a gun in. So we do have a lot of cases, and I think nobody here can deny that people, they're
crazy.
We always used to say there was a short fuse, and there's no fuse now. That's one of the reasons why our health home visitors wanted the training, because they are now going to be going into these individuals' homes, and there's a lot of safety concerns on all fronts for everybody.
And we have had a recent conversation I've had with clients, they've kicked the doors when they're angry men that have come in with their female partners. I've asked them to leave the building and they did, but they kicked the walls, they're threatening. The women can be just as threatening if they're uncomfortable. And there was a discussion that they're talking with the deputies about rounding now that we're back to in-person services, because we have small waiting areas outside of this big one that are back here for WIC and for dental. And so there's a lot going on in isolated parts of the building now that we've returned in-person service that could lead to some discomfort.
What about when someone comes in the door, if they have the appointment, why is it that they can bring other people? Why don't they just have that one person who
We've
comes in?
tried that, but there's times where they need, maybe it's a language barrier that they need an interpreter with them. Or maybe it's a medical need and they need somebody to go with them. So there's always different circumstances. And it's hard for us to say, I'm sorry, you don't qualify for that. I mean, how are we really to know if what they're telling us is the truth or not?
We literally have situations where they're teens and the mother or the father is speaking for them. They're support people, in other words, they're
Or
bringing
maybe
a couple
say
of top.
one person,
Pardon?
one person come with that person.
Like I say, we had just 2 people with the child and the man got hacked, kicked the walls, got threatening.
Oh, yeah.
So if we have 2 people, it can happen. It happens when we have one.
Yeah.
And just
We
in
had a guy
dental
in the
thing
diner
for the
this
whole
weekend.
family.
He brought a knife and was in the restaurant, just crazy. And we didn't know how. My son is my manager and he took his glasses off because he was crazy. Then he was outside jumping on picnic tables and it takes forever for the police to come. It really does.
Even beyond just
When I first got on the
security.
board, safety was a big thing for me, and that's one of the things I sat down initially with Brandy about how to secure the building better by compartmentalizing, different areas of the building, and that's worked out really well, and maintain more secure perimeter access. I know when I come in here, people know me and people don't know me. I don't get past the front door because they call whoever it is I'm here to see and say, Mark's here to meet with you. So I think the staff does a good job as gatekeepers, allowing, but once you get on the other side of that wall, then there's a lot of places you can go. I would suggest what we do going forward, and I know we had this conversation in the past, that I would like to see us maintain some level of presence of law enforcement here. And so maybe we might look at what we had looked at in the past, potentially maybe not as many hours. We talked about the possibility of 2 part-time individuals here, maybe you've got somebody from 9 to 12 and then somebody from 1 to 4, so maybe you, if you could knock a couple hours a day off, the range when you guys have the most traffic, I guess, we might ask you guys to kind of give some input on that, saying, hey, if we had somebody here from 9 to 11, and then you got lunch breaks going on or whatever, something that we could help you guys be able to keep having somebody here, but maybe not the entire day from the time the door unlocks until it closes again. We're having somebody here when we have our monthly board meetings, which I appreciate. I don't know that it's a necessity because the rest of the building's locked down, but I think we need to look at some things, because when you're in this situation, you gotta pay what they charge for hire back. There's no way around it. We talked before with the sheriff about it. The only other option we've got is to hire a private security company to come in and do stuff, and that to me is very ineffective. It's not a good use of money. I've watched a guy out at the SOS office, and I literally was standing there the day this guy came in. He had a bad attitude. He went straight to the desk, and the next thing you know, it was a knockdown, drag out fight. This guy didn't have any kind of protection, no weapon, anything. And this guy was just a little bitty guy, and he was taking on a really big dude. And they finally convinced him that he needed to leave the building, but it was about to turn ugly, like just that quick. And that's in the state office where the Secretary of State Police used to have a president, and they have for a long time. They've contracted this stuff out. So there's a lot of potential to be at risk there, so I don't want to see staff in that situation. So I would like to encourage us to continue this between now and the time that this expires, and we come up with a plan maybe cut back on the hours, still provide some basic service here
Okay.
from a safety standpoint. I would feel better about that myself.
You said through May, is that May 1st or May 31st?
May 31st.
Okay, so we'll have another, okay,
Yeah.
we'll have another meeting.
So I'll talk with each of the directors to figure out what they would consider high traffic or more at-risk hours. Because right now we have them here from 7 a.m. to 4:30. And so if we can, like Mark had suggested, dial that back just a little bit from a financial standpoint, I can chat with each of you guys about that to keep the services in place and.
And I think the staff will still feel really appreciative of just having that person in here. And I know that Lindsay and I have talked about kind of coming up with some expectations too for them, because we have a few that kind of do the same thing that Mark's already talked about, but you know, we've got some excellent deputies too that are walking outside, walking the building, and it makes a difference to the staff, it really does.
And they assist beyond security as
Oh,
well,
yeah.
like we have a woman who came in that she was obviously was not alert or oriented and was trying to get a train to New York. And the deputy went really out of his way and spent a lot of time with her trying to see if she was supposed to be here, did she have any business here, ended up helping her get to the hospital. So they do a lot that there was nobody here in the health department that was working with this woman. She just wandered in because we're the health department and she thought we would get her on a train. And they took care of that as, the deputy took care of it.
Yeah.
May I ask, Karen, when you talked about secluded areas, are you concerned, you feel like there needs to be any security cameras?
Well, it's my knowledge that we do have security cameras that are already in place
Oh,
throughout
okay.
the building.
Okay.
In terms of, the timing of it, if there's a guy rounding and he's visually seeing something
Right.
erupting or can hear something, that's so much more beneficial than losing people or having harm happen when they weren't around.
Right.
Just
Or
their
just the
presence.
clients thinking
Yes.
they might be rounding.
Yeah.
You don't
Yeah.
even have to have
Every
them
key,
rounding.
I keep them on WIC 5 years, they're rolling in here every 3 months.
Yeah.
And if they see that presence.
Right.
Or even a car in the parking lot, it's a really cool way.
Well, change of routine's good too for an officer to stagger their schedule going around the building and stuff too, because there's people that study
Oh, yeah.
people's habits and activities, and that's how they make a decision when they're going to do something.
I agree.
Yeah, we
So-
had a guy here in the past with a camera going in the main waiting room with little kids that would be going in and out to go to the bathroom, something wasn't right there. There's been things over the years, we've had so many inebriated people.
Yeah.
A lot, very, very,
On multiple substances.
yes, and and the ambulance people are horrible to them. But having the sheriff here, it's just helpful. They've always been great, the police and the deputies that I've dealt with here.
But we'll work towards trying to figure a way to trim the time down a little bit, help to reduce the costs somewhat, still give you guys some peace of mind, and I think that's important.
Thank you.
Okay, discussion regarding bylaws related to Board of Health member attendance.
So the bylaws currently just state that we require Board of Health members to attend most meetings. They're not specified or written out in a formal, 70% of the meetings in a year or 8 of 12. And so I don't know, I might have to defer to Mike a little bit if we have or if we want, obviously, if you guys want to have a requirement in the bylaws that states that you do have to attend a more specific amount of meetings in order to retain as an active board member. So kind of gonna leave that up to your guys' discretion and of course with Mike's input as well, if that's something you'd like to move towards, or if we can even move towards that.
My own opinion is if you decide you want to be on a board, regardless of organization, you need to be actively involved. And other boards I've been on, the expectation is you attend at least 50% of meetings. If you're unable to do that, then you either will be asked to step down or a conversation needs to take place to try to facilitate a more active role. I know we've had some people on the board in the past and one now that attendance has been a problem. I want to have active board members here that can participate in discussion and make decisions about what we need to be doing for the betterment of the county. And you can't do that if you don't have people that don't attend the meetings and become involved, because there are people out there that want to be involved, and unfortunately, they're not afforded that opportunity because, we're not filling the seats up. And I mean, I understand everybody's got other activities outside the department, to attend to, and there's going to be situations where people are just unable to attend meetings, but if it becomes a habitual issue, then I think it's something that needs to be discussed either with the board as entirety or, the officers. So I'm open to suggestions, but my opinion is I think you need to be here for at least 50% of the meetings. I'd like to see it higher than that, but I think that's a minimum.
Mike, do we have the ability to amend our bylaws so that it was, kind of in written formality? Is that something that?
You can, I will note, that your bylaws currently state, and there's a reason they state it this way, that, board members, each March, the nominating committee shall review the participation of each board member and provide the results of that review to the board. The board at its April meeting shall review the nominating committee report and consider, as to each board member, any absences from regular or special meetings, participation on committees or other activities, and representation of the board in the community. A finding by the board of lack of conscientious overall participation by a board member shall be communicated by the president to the county board chair, along with a replacement recommendation identified by the board through the nominating committee. Obviously, the board members have terms of office, and while the nominating committee meets for this purpose at least once a year to communicate to the county board chair, the board, neither this board, well, we'll just leave it here. This board does not have the ability or authority to remove a board member for lack of participation. The appointment power to this board rests exclusively with the county board. There is, I believe, provisions within the county's code that allows the county board chair to remove a board of health member, and I'm in the process of trying to find that statutory section so I can quote it to you accurately. And neglect of office may be one of those reasons. It may be just malfeasance in office. So, but the long and short of it is you can amend your bylaws to include a specific participation expectation, but that's all it is an expectation. Whether the county board chair acts on that recommendation or report from this board is up to the county board chair. So this board does not have the ability to punish or remove a member for lack of attendance.
But we could have an attendance policy though.
You can have an attendance policy that, but I mean, I would argue, I think, that you don't have a specific requirement right now. What you have is the ability to look at every board member's participation and then make a report to the county board chair of, and you can say, these are the 11 members of the Board of Health in the last year. This many attended 100% of the meetings, this many attended, only 8 meetings, and this one, missed all but 2. You can put those things in writing and make a recommendation based on those findings. But I don't think that requires you to adopt a formal policy, and if you do adopt a formal policy, you have to understand that it's toothless because you don't have the power to enforce that policy.
So the best thing is to track attendance and just report on an annual basis to the county board chairman and let him use his discretion on.
I think you have the ability to adopt certain expectations and put them in your bylaws, but I just caution you that if you do so, do it with the foreknowledge that there's a limited power that this board has with respect to enforcing it. Right now, I think you have certain amount of power already granted by your bylaws, and I'm not sure you can get more.
I like the way it's written, that the attendance be reviewed, discussed, and the recommendation and the findings to the county board chair.
And I'm sorry, but if I may for just a moment, I did finally find this section. A member may be removed for misconduct or neglect of duty by the chairman of the county board. Again, with the approval of the county board, so it would be ultimately a final county board action, but it has to be done by the chairman. So if this board finds neglect on an annual basis, so you don't even have to wait till a member's end of term, but if you find neglect at the annual analysis or at any other time, you can always report that to the chairman of the county board, and if he decides to act on that, he can.
Okay, so since we don't have this as an action item tonight, it's only discussion, then I would suggest that we put this on for next month as an action item if we choose to change anything. If not, then I suppose at this point, all we're gonna do is forward a attendance report to the chairman, just for FYI.
And if you're going to change the bylaws, again, you have to have those done in a particular way. So if there's a change that you want made, it wouldn't be a formal vote or anything tonight, but I would need some direction so that I can draft it and get it to you in time to be voted on in May. Because right now,
The only language I could think, Mike, to put in there, since you said it doesn't really have any teeth in it, would be the expectation is every board member will make an effort to attend all meetings. Those that do not may be subject to action by the county board chairman. I don't know how strong of a language you want to put into that, or could be subject to board recommendation to the county chairman or replacement, or, I mean, I'm not sure how much we want to put in that without crossing the line of
well, I mean, what you have right
having that
now,
authority. We don't have that authority, but put the language in there. I mean,
what you have now already has that last part. The
Yeah.
first part about the, setting a numerical expectation or a percentage expectation, you don't have that, but you do have that last part already.
I mean, I don't know, since we can't really act on it, I don't know that putting a number to it's really gonna make any difference. I think
No,
if nothing else, we provide the chairman a report every 6 months on attendance of board members, just to keep him in the loop and keep him informed. And if he sees something that doesn't sit well with him and he wants to make a decision to replace somebody, then I guess he could reach out to us and say, what's going on here? Or, is this person, actively involved when they're at the meetings, or are they just warming a seat and I need to find somebody else? I've got a doctor waiting. I mean, that's one of the things we have to consider is the balance of the board in terms of the makeup of the board. So it is important, especially when we're looking at doctors that are on the board, that we have active members, because by statute, that's part of the requirement that we have that makeup. So that is important, that we have active involvement. So I don't know, I think we're going to just leave it the way it is for right now, and just forward a report to the chairman as an advisory to let him know where
just
things
follow
are at.
what's already there.
Yeah. Okay, anything else on that?
I think I was the one that added that to the agenda, and I appreciate all the discussion. I've spent quite a bit of time thinking about it, and the metrics do feel a little bit heavy-handed, and, by all rights, they ought to be 60, 75%, but that's kind of heavy-handed. And I think your point, Mike, is well-founded, that if there's no teeth to it, it's really at the discretion of the chairman and the county board, if the person is
No, and it's
remains or removed.
as Jeff can attest to, and those of you who have heard about and witnessed firsthand the county board meetings dealing with the milestone policy, you know, you have to understand that if you go to the board, if you convince the chairman to move to have someone removed for neglect of office, it may not be a rubber stamp for that based on a recommendation from this board or the motion of the county board chair. You might get questions and people getting hung up, and if you go that route, be ready to back it up, you know, and if you can, you know, by showing, documenting, you know, someone has missed this number of meetings in the last X number of months, that's going to help your case, but it's not going to be an automatic or even necessarily a smooth sailing situation. I think that it's clear at this point that the county board is not necessarily going to rubber stamp informed recommendations made by this board.
I appreciate all the discussion tonight. I think it was good discussion.
Discussion regarding potential board vacancies, which dovetails right into what we were just talking about. So we will have some terms that are coming up, not necessarily vacancies, that the chairman will review, and barring any issues, we'll renew those terms. And potentially, if we do have a vacancy, as we just talked about, then we need to submit names to county chairs. That comes up, and right now we don't have anybody that's made a commitment that they're not going to be willing to serve, you know, if they're given a term renewal. So at this point, I don't think we have anything. I don't know, have you talked to Dr. Manigati at all lately?
I have not.
Okay. So, discussion regarding the fiscal review for Macon County Health Department. It's been brought to my attention by some people that it's something that we should consider doing. I've reached out to some people, Jeff has too. Currently, the county gets an audit done. Not that the auditor's office doesn't do a good job on the day-to-day operations, but they do get, the entire county does go through an annual audit with Macon. Here in Decatur, I talked to Kathy Manser about around the time that they were starting the auditing process for the year. And she was actually getting ready to do the health department part of the county audit. As of right now, I talked to Carol last week at the county board meeting. They do not have that report back yet for the annual audit. It's probably not going to happen until probably sometime in May before they get that report back. She did suggest that we probably reach out to somebody to have a fiscal review done of processes. And we're looking at that because we have had some changes in staff and administrative leadership, just to make sure that we've got everything in place, and go back and review when the audit becomes available, review that audit, and just get a different set of eyes on that. So that's strictly information for the board right now, but we're gonna wait until we get it was Carol's recommendation, we wait till we get the county audit back, because that will identify anything that they may have found issues with in terms of processes that the health department currently has. They do this for every department throughout the entire county. So it's not just the health department that gets reviewed. It's an annual audit they do every year. And if we think there's some things beyond that, some recommendations that are made that we need to do, then we may bring somebody else in to kind of advise what changes we might need to make in some of our processes. So that could be administrative processes, it could be financial processes. They look at a whole gamut of different things in the auditor's office, and also the audit is done by that organization as well. So I just want to give everybody a heads up on that. We may potentially be requesting an outside source to review that information once the audit's finalized.
One thing you might want to look at is the last fiscal review or administrative review with the BHS did on the health department.
Okay.
They did one routinely every 5 years or something like that.
When's the last time that was done?
I don't know.
We have one actually coming up on June 6th.
Okay.
and I don't know when the last one was, but I do know that's the last one.
Well, it's good to know we have one done.
Electronic in there too, so you may want to make sure Bill knows the rest.
Yeah, okay, good, appreciate that information. Discussion regarding the importance of the following policy for submitting invoices and receipts in a timely manner. This recently came to my attention directly. I discussed it with Lindsay about some concerns that I had that there were some issues with some staff members that weren't turning in information that's being requested in a timely manner. And I want to reinforce the fact that there is a policy in place to do that. And that process needs to be followed, mainly because everybody's got a job here to do. And I need to make sure that the CFO is getting the information she needs to get the stuff submitted in a timely manner for getting expenditures done that has to be done with checks being sent out. We have to approve the expenditures. So there's a reason why there's a timeline that needs to be followed with this. And I think that the conversation has taken place with those that were impacted by this, but I just wanted to give everybody a heads up that the expectation is from the board that staff will make every effort to make sure that they're doing that in a timely manner, and if there is issues with that, then they should direct them directly to the administrator, whoever that might have to be at the time. So that's all I had on that. If anybody else got any comments or questions on that? Okay, next, discussion regarding status of complaint related to sewer installation inspection. I know Mr. DeBoer was going to be here tonight. At least I was led to believe he was going to be here, and he didn't come. So I don't know what else we might have on our side to discuss about this specific issue. If you've got something.
Collaborate with Kathy here, but we really don't have any further updates from where we were last time. There has been no further communication with our agency regarding the public comments that took place at the March meeting. We're doing our, due diligence internally to make sure that things are completed per policy moving forward, but we have not had any further communication from outside.
And Mr. Baggett, if you wouldn't mind sharing the information you provided me about what the position of the health department is in this particular situation.
With respect to situation, a license or a permit was issued. I don't believe, and Mark, you're catching me a little off guard. I've slept several times since our conversation. But basically, there's no tort here with respect to the health department's involvement. There certainly is some issue, or appears to be some issue, between the installer and the homeowner. Without getting into the mix of it, whether the health department issued a permit ultimately, I don't think is material to Mr. DeBoer's issue. I don't know that the health department has any particular role to play at this time, other than hearing the complaint and, to the extent possible, making changes to the way it might approach these types of situations in the future. But I don't know that there's anything that the health department can do at this point to fix what appears to be a contractual issue between the installer of the septic system and the homeowner, whoever that was or may be now. And certainly there might also be some issue between the seller and the buyer. But again, I don't think that the health department is a party to any of those things. And with respect to the Tort Immunity Act, to the extent that the health department issued a permit, I don't believe the health department has any exposure for issuing that septic permit to the person. And I'll have to defer. Kathy, am I getting that correct, that we did issue a permit?
Correct.
Yeah, I just, I don't believe there's any legal exposure by the health department for the issuance of that permit. Generally, in municipal law, governmental law in general, the issuance or denial of issuance of a permit for a non-civil rights related issue is not actionable in a court. Governments can't always be on guard for issuing or not issuing permits. We can't deny permits for discriminatory reasons. We can't issue permits, based on bribes. As long as we're not violating the law in that way, the issuance or denial of permits is not actionable from a civil action point of view. So I don't believe that the Board of Health has a role here other than, again, to hear the complaint and to address it in terms of making sure that if there's a way we can prevent this type of thing from coming up in the future, then that's great, if we can. But I don't think there's anything we can do to fix what happened between the septic installer and the homeowner. I hope that is.
That covered it very well. Thank you.
And again, I apologize, it's been more than a week or two since Mark and I had that conversation.
Okay. I'd like to get a motion to go into closed session pursuant to section 2.C.21.
Let me correct you right there for a second, Mark. I'm sorry, I read that off of the agenda. It's going to be section 2C1 regarding the appointment, compensation of a specific employee, and section 2C3 regarding the appointment of a public official.
Motion to go in closed session. Second. All those in favor?
Aye.
We will go in closed session and Have you got us live again? Okay. All right. We're back in open session at 7:45.
Roll call.
Roll call, please.
Mark Scranton,
Here.
Jeff Antler,
Here.
Katie Clevenger,
Here.
Carolyn Moore, Jan Hack,
Here.
Debbie Hill,
Here.
Dr. Smith,
Yes.
Marshall Wills.
Yes.
Okay, per our discussion in closed session, we will now take action in open session on the appointment, employment, compensation, discipline, performance, or dismissal of specific employee of the public body. Action. Mr. Baggett, can you give us the proper language here now?
The first motion before the board, if the board member will move to allow Ms. Munsterman to promote the name of the employee, I'm sorry, I don't know her name,
Kim,
Kim,
Saban Pritchett.
thank you, into level 9, in spite of the policy prohibition on the educational attainment, but the board would give the permission basically for a waiver of that requirement to promote the employee into level 9 with a salary to be determined by the administrator based on her discretion within the range given in level 9.
So moved.
Second.
All those in favor?
Aye.
Any opposed? Motion carried. Second item.
This would be a motion by a board member to appoint Lindsay Munsterman as the public health administrator for the Macon County Health Department.
So moved.
Second.
Any discussion? All those in favor?
Aye.
Any opposed? Motion carried.
Last motion. The last motion would be a motion by a board member to set the salary of the public health administrator at $110,000 per annum.
I make that motion. Second.
All those in favor?
Aye.
Any opposed? Motion carried. Motion to adjourn.
Second, first, third, fourth. Time to go.
Thank you, everybody. Lindsay, what's the deadline? Do we can turn these in by
May 1st.
May 1st? Reminder, don't turn your economic interest form yet tonight. Needs to be